Hello, everyone, and welcome to Why Lifestyle Beats Medicine for lowering blood pressure and for living longer. So we'll give people a few moments to arrive live, but if you're watching on the replay, then fantastic, absolutely fantastic, because I've designed this webinar to actually prove that you can lower your blood pressure with natural means just while you watch this. You will find out as you watch this, and some people do lower their blood pressure. So first of all, congratulations, basically. Congratulations on taking the time to join this workshop, no matter how you are actually joining it. If you're here, it tells me that you really do want to do something about your blood pressure rather than just take pills for the rest of your life. But it also means that you're not just content to have high blood pressure and not take those. You actually really understand that having high blood pressure is a concern. It does tell you that there's a problem that needs to be taken care of, and if you take care of it properly, you will live a longer, happier life, and you realize that. Now, this webinar is not for people who are happy to take drugs for the rest of their life and don't want to explore anything else. This is not for people who aren't actually coachable and willing to learn and take action. It's not for people who have a fixed mindset, and it's not for people who have no ambition to grow and be taken out of their comfort zone and to explore something new. So today I am sharing with you what is possible if you overcome the myths and remove the barriers that are causing millions of people to stay unnecessarily on drugs to treat the high blood pressure, and to understand what the true causes are so you can take action and get better. If you stay until the end, okay, you're going to learn why relying on drugs can actually be dangerous and what to do instead. The biggest myth stopping millions from achieving optimal blood pressure, the secret major cause of high blood pressure that drugs can't treat and doctors very rarely even suspect or look for, the miracle molecule for heart health and blood pressure, and learn how to get my extra bonus videos and documents and the 6 questions to ask your doctor if you want to get the miracle molecule training, and also the most important next step to take if you want to take a shortcut. You don't want to do this by yourself. You want to actually do something quickly about what's going on. So if you're watching this on the replay, sorry for everyone here. If you're watching this on the replay, okay, in a moment, well, actually, I want you to stop the recording right now, and I want you to go and take your blood pressure. Okay, and then once you've taken your blood pressure and taken a note of it, I want you to email me what your current blood pressure reading is. So at the beginning of the webinar. So if you're watching this on the replay, stop it right now, go and take your blood pressure, email me your current blood pressure at the beginning of the webinar, and then come back. Okay, right. So now you're back on with the show. The first thing I want you to do is yawn. Now that you've taken your blood pressure, and email me what your blood pressure is, I want you to yawn. Okay, don't worry, I'm going to get into some other things in a moment, like who I am. But I want you to yawn, because yawning actually cools down your brain. And one of the major causes of high blood pressure is literally too much stress and tension. And when you yawn, you actually increase the blood flow to your brain. Okay, you might think, hang on, doesn't more blood heat up the brain? Well, no, because it acts like a radiator. More blood actually helps cool down certain areas. It switches off your imagination, your over-imagination network, and allows your system to just calm down, even if it's just temporarily. And there's a number of techniques that I use with my patients that can involve yawning that can actually decrease the stress you feel all day long, just with a simple morning practice. But first of all, just take a yawn. If you'd like more training on yawning, then reach out, ask me about why it's so important. But throughout this, I'm going to have pictures of this lovely cute baby yawning to remind you to stop the recording and yawn and relax and think about what you've just learned before you yawn, or think about what you just heard, and then write down some word that comes to your mind after you've thought about what you've just learned. You've taken a break, you've yawned, because when you take breaks constantly, you're actually going to integrate more what you're going to learn, and it's going to help you remember it, and you're more likely to then take action, because this is the most important thing. It's no good you learning stuff without taking action, and just by repeatedly yawning strategically, you may find that your pressure goes down. So, and there's something else I'm going to ask you to do at the end as well. So here we go. So you've had a yawn, good. So who am I? I'm Chris Pickard. I'm a Bachelor of Science. I'm originally trained as a chiropractor, and I'll tell you what chiropractic's got to do with blood pressure in a minute. I'm also a functional health and lifestyle consultant, and I wake up every morning to inspire everyone I meet to get excited about their future health. So many people think that as they age, they've actually got to get old and decrepit. I see this with patients 10, 15 years younger than me. Yes, I am very often the most physically fit person in the room, even with people 10, 15 years younger than me. But a lot of it's to do with attitude. And so one of the things I do is I paint a brighter future for my health participants. And I'm also passionate about peace. I believe that world peace starts with self-peace, and self-peace starts with self-health. And if we all look after ourselves in a deeper, more meaningful way, it's going to have a greater effect on our own self-peace and our self-worth, and that's going to help us spread self-peace and self-worth to other people. Maybe we're going to actually change the minds of some of the people making crazy decisions at the moment in the world. So I am the first UK graduate of the Cardiovascular Health Institute, and I may be the only one at the moment as well. So that means I've been trained by a cardiologist on how to actually get people off drugs and into a healthy lifestyle so they don't need the drugs. So I don't tell people to stop drugs. I want to make that very, very, very clear. I actually treat people by actually finding the true cause. You treat the fine cause, and then working along with the person that's prescribed you the pills, they can see that you clearly don't need them anymore, and you can come off, because they will tell you. I'm also an ex-beekeeper. I'm an allotment owner. I'm now a dog owner, and I have one teenager and a 20-year-old. There's me with a strawberry from the allotment, and there's me with my dog, Lily. I also have my picture in the Guinness Book of Records in the 2014 edition on page 70 something or other, and the picture you see is probably bigger than the life-size version. So I don't hold the record anymore, along with about 400 other people in our village that are part of that record attempt, but we no longer hold the record, but I'm in the book, so there we go. I'm famous. Now, this isn't me, this is Julie. Julie in Harpenden. And Julie found out, well, she'd already worked with me in the past for her knee pain, I think. And she found out that I was helping people lower their blood pressure. And she had realized that her father had been on medication and drugs and still died young of a heart attack. And she was approaching his age, and she was on drugs. And as she was getting older, she was getting on more drugs, because she'd take one set of drugs and then she'd take another set of drugs to stop the side effects of another one. And upon starting the program, the Beat Blood Pressure program with me, she'd halved her medication in 6 weeks. And after 8 weeks, she'd lost 14 pounds, stopped all of her medication, and also lots of her aches. In fact, all of her aches and pains went as well. So it is possible to basically have parents who died young of heart disease, for you to be young and have problems, and then you do the right stuff and you get better. It is possible. Now, why am I so passionate about heart disease as a chiropractor? Well, it's because heart disease is on the rise. This is part of the reason. I'm going to explain. Heart disease is basically on the rise, okay, up again since 2019. And what's leading the charge is basically blood pressure. Blood pressure is the leading cause of strokes and heart disease. And more people have high blood pressure all the time, every year, partly because the rules or the definition of what high blood pressure has actually changed. So it's now easier to have high blood pressure, but it's also because there are more people just having high blood pressure, and it's happening younger and younger and younger. And it's not because our genetics are changing, it's because, well, you'll find out. And in fact, it's almost 50% of the US adult population, it's similar in the UK, have hypertension. whereas about a quarter have arthritis, a fifth have respiratory diseases, chronic mental conditions. Just general heart disease as a total is like 10-15%. But hypertension, nearly half of all adults have some kind of high blood pressure problem. And it's linked to some major problems. Okay, so why do we treat it? Because high blood pressure is the third largest risk factor of premature death and disability in England, behind smoking and poor diet, both of which can cause high blood pressure. It's linked to 75,000 early deaths every year in the UK. 50% of heart attacks and 75% of strokes are thought to be due to high blood pressure. And it's a major risk factor of chronic kidney disease, heart failure, and dementia too. Because the thought is that basically as the pressure rises, it damages the arteries and blood vessels in the brain, so it can cause dementia and strokes, the eyes, so it can cause blindness, the heart, so it can cause heart attacks and heart disease and heart failure, the kidneys, so it causes kidney failure. But as you're about to find out, it may be a little bit different. And it may be the actual cause of the arteries to be inflamed and fall apart can actually be the cause of your high blood pressure. So high blood pressure itself is a symptom of your cardiovascular system failing for multiple reasons. So why am I so interested in heart disease and high blood pressure? Well, here's my father, and the guy waving on the left, not the young lady holding a needle. And the lady munching food behind my dad is my mum. Now, my father in his 50s, he's never been particularly overweight. He's not been completely sedentary. He has always loved walking. And he started getting high blood pressure and then high blood sugar, partly possibly because of side effects to the high blood pressure drugs, but that's another story. It's the same story actually in a moment. And we found that when he came in to the clinic to have his neck manipulated and aligned, his blood pressure would go down. And it turns out that a lot of people have high blood pressure because of hidden neck pain and neck problems. And this is documented that massage therapy can actually help of the neck, can actually help lower blood pressure. And there are some trials that show that appropriate chiropractic care to the neck can actually help lower blood pressure in some people. And interestingly enough, I actually have a patient at the moment that when we look after his neck, his blood sugar is also decreased, which brings me back to my father, blood sugar. Now, my father, as well as having high blood pressure, had really high blood sugar, despite the medication, despite the advice he was following from the dietitians on the NHS. His blood sugar was getting higher and higher. And it was so bad that the drugs weren't keeping that under control. And my father was told he would need insulin in a month's time. Now, insulin is the drug that your pancreas makes to control blood sugar and to get it into your cells and out of your blood. But my dad is absolutely petrified of needles, so much so that he will have teeth pulled, okay, with just like a dab of anesthetic on the gums rather than like an anesthetic spray, rather than actually have a needle anesthetic. So yeah, he'd rather have pain than have a needle in it. So he said, what can we do? And so luckily I'd just been on a course and I said, here, Dad, why don't we try this? And what happened was he followed a very strict diet. I'll tell you right now, he basically only ate vegetables, raw vegetables mostly as well. He basically had a raw, pretty much vegetable, and I think he said I had fruits as well. Yeah, raw vegetables and fruits only. That's basically what he did. Nothing else. If it wasn't a raw fruit or vegetable, so basically no alcohol, tea, coffee, I allowed him to have one cup of tea, I think. And I was very, very strict. And some people will thrive off this diet. After 2 weeks, my dad's blood pressure and blood sugar actually came under control, and they were actually healthy, but on the drugs. My dad, being my dad, he doesn't like taking drugs. And so he, without consulting his doctor, basically weaned himself off of the drugs over the next week to see what would happen. And after 3 weeks, he had completely normal blood pressure and normal blood sugar without any drugs. And then after 4 weeks, it was all still completely normal. And he went back to his doctor, and his doctor said, I looked at the readings, said, fantastic, Mr. Pickard, the medication is finally working. And my dad said, actually, no, I stopped the medication 1 week ago. and everything's been fine for the past 2 weeks because of the diet that my son put me on. And this is how the doctor responded. Well, he didn't actually put a paper bag over his head and stick his thumbs up. He basically didn't ask anything. He just went, oh, and that was it. He didn't want to know what my father had done, didn't ask any details at all, didn't want to pass it on to any patients whatsoever. Seemed to be completely uninterested in the fact that this was a miracle as far as he was concerned. And this, I've come to learn over the past 15, 20 years, is pretty much not just how many doctors, but also many patients are actually, first of all, they don't want to know that they don't have to take drugs and that their disease is not necessarily a disease, it's a lifestyle problem. So anyway, what I'm going to be going through is what you can do, because I've learned a lot more since working with my dad. And you might be thinking, you know, my doctor's tested everything and everything's come back normal. My problem's genetic. You might be thinking once you're on drugs, you have to stay on them forever. You may be thinking it's difficult to be healthy. Now, as you've seen from the two stories, okay, doctors, they often do say everything's normal, but you still have a problem, as you've seen it. And again, all of my grandparents had diabetes and blood pressure as well, problems. And so you can see it's possible to come off the drugs. And you may be thinking from what the diet that I put my father on that it's difficult to be healthy. That's why I've improved things and have worked with ways to actually make it easier so that you don't have to stick with that diet for the rest of your life. And that is just what worked for my dad, and there's reasons why. And for some people, it doesn't work at all. Okay, you actually only need 3 keys to succeed. You need to be coachable and willing to take action. You need to be able to focus on progress. You don't need to be perfect. You just need to do a little bit better each day or week goes by. You don't have to get everything right straight away. And you must commit to never let your self-doubt stop you from having what you actually want. So are you ready? Okay, because you can do this. You can do this. And if you're at home, take a break. Have you on? So paradigm shift is now in order. Paradigm shift basically means that it's the equivalent of you're walking along the street and you've got blinkers on and you can only see like there's a this way ahead. Okay, you're completely oblivious to all the other possible directions and alternatives in the world. So up here you see like a smog-filled factory and you see a cliff or you see horror. Okay, whereas if you actually looked over here, over another direction, you see beautiful people and beautiful things. So we're going to basically make you look somewhere a little bit differently by making you address and realize what the big problem is. The big problem is that the drugs don't work, not in the way you want them to. Okay, blood pressure drugs are actually failing quite miserably to tackle the underlying problem, as you've seen. Like blood pressure, the amount of people with blood pressure is going up, and heart disease is still going up despite more drugs. Only 34% of people on medication actually respond favorably, i.e. one drug brings the blood pressure under control. 97%, apparently, according to this survey, report significant side effects. I have to suspect that that's overinflated though. 50 to 80% of patients are not compliant with treatment. I believe that. Somewhere between 50 and 80%, and 4 out of 10 discontinue treatment due to the side effects. I can believe that. Okay. Blood pressure medicines, okay, for 5 years to prevent death, heart attacks, and strokes. Now, a lot of people, you're probably already reading this now, a lot of people think that if they stop taking their blood pressure pills, that they're going to have a stroke and die in the next few days. And you've got to take them every single day. And that it's actually the drugs lowering the blood pressure, and that's what actually helps you. But here's the thing. Out of every 125 people that were given blood pressure drugs over a 5-year period, 1 in 25 deaths were one in 125 people, there was a death that was prevented. 1 in 67 people were prevented by having a stroke, and 1 in 100 were helped by preventing a heart attack. And so that basically means that there are still a lot of deaths, strokes, and heart attacks, but in the people taking drugs, there was just slightly less than the people not taking drugs. So basically, that's over a 5-year period. Taking drugs, okay, if you want to basically prevent a stroke from high blood pressure, there's a 1 in 67% chance that you might be the one that it helps prevent a stroke. Okay, so overall, on an individual basis, medication doesn't make a huge difference. Now, if you're the person that's going to be prevented from dying, then obviously it's making a big difference to you over 5 years. It's a 1% chance. So, but when you give thousands and thousands and millions of people drugs, you're going to decrease the amount of deaths and strokes. But it's not actually solving the problem for every individual. There's a better way that can prevent more deaths, more strokes, and more heart attacks. Okay, and the reason why drugs by themselves don't really work for everyone is because all drugs focus on for blood pressure, nearly all drugs for blood pressure focus somewhere on this system. This is called the RAS system, or the renin-angiotensin aldosterone system. And so what happens is, when you have low blood pressure, I'm not talking about high blood, when you have low blood pressure because you've got a lack of salt in your diet, and maybe you're not drinking enough water as well, because you may have noticed in the wild there are what are called salt licks, where animals go to travel to get salt. Salt is very, 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 as in sodium. Sodium is very, very important for our entire physiology, for our entire system to work. Sodium is used in so many different, it's used in every single cell. Without sodium, you can't actually get blood sugar into your cells. So if you have no sodium, your whole body stops working. And it's so important that your body will do things to basically make sure you keep salt in your body, and you can actually raise your blood pressure. Because if your blood pressure is too low, you can't pump blood to your brain, and you won't think, basically. It's the easiest way to present this. So what happens is your kidneys have sensors. They think, okay, the blood pressure is a bit low. Okay, and so maybe it's because there's not enough water, maybe because there's not salt, because salt draws water into the blood vessels. So what I'm going to do as a kidney, I'm going to secrete a drug called renin, and then the liver, if it's properly working, will convert it into something else, and then the lungs actually secrete something called ACE, the angiotensin converting enzyme, okay, to basically turn angiotensin 1 into angiotensin 2, and then that then goes to your adrenal glands, and your adrenal glands, you get up and go, and they make something called aldosterone, and aldosterone then tells your kidneys to increase sodium and water retention. So as you increase sodium and water retention, you basically get more stuff in your blood, so your blood pressure can go up, so your heart doesn't have to pump so hard. And also what happens is angiotensin-based angiotensin tells your nervous system to constrict your blood vessels to make them smaller and tighter, so there's less room for the fluid, so it basically increases your blood pressure, so you can pump nutrients to your brain, for instance. So this whole system is in place to protect you from dehydration and low salt. But today's society, people may be dehydrated, but people tend to have too much salt, and it may actually not be the sodium. It may actually be the chloride part of sodium chloride, which is table salt, which is quite unnatural. It may be the chloride part that's the problem rather than the sodium. But anyway, if sodium goes too high, then your blood pressure is going to go too high because too much water is drawn in, or if you haven't got enough water, it's too thick, it's harder to increase. But the drugs that we have renin inhibitors, we have ACE inhibitors, we have ARB inhibitors, and this stop this mechanism at various ways. And so even if you've got normal blood pressure and you take some of these drugs, your blood pressure will probably go down because you're inhibiting your normal mechanisms for keeping your blood pressure where it should be. So it will probably go down. Even if you haven't got high salt, your blood pressure will go down probably if you take these drugs, because you're going to get rid of more salt. And that can cause problems. So the problem is, though, is that so many people, their high blood pressure isn't anything to do with salt. And so they can take a drug, it can lower their blood pressure, but the real reason that they've got high blood pressure is still there, so their blood pressure still goes high. So they take another drug, which may lower their blood pressure, or it may not, and then they need another drug. And it just goes on and on and on and on. So The first thing you need to do though is realize that one of the biggest myths in blood pressure is being concerned, well, is being overly concerned about taking your blood pressure readings every day. This is a cardiologist, Dr. Sanjay Gupta. You can look him up. His website's York Cardiology. And one of my favorite videos is basically myth: you need to treat numbers to live longer. You don't. He's recommending, or you need to count numbers. He actually says, instead of counting your blood pressure or looking at your blood pressure every day, actually count how many times you are thankful every day. Count how many times you're grateful every day, because actually looking at your thanks and your gratitude actually makes you happier and lowers your blood pressure. Whereas focusing on your blood pressure can actually just make you stressed and raise your blood pressure. So he's full of great advice. He's a cardiologist. And this is, so rather than just cardiology or cardiologists with fancy ideas that are pretty good, let's actually look at one particular class of drugs, ACE inhibitors. So ACE inhibitors basically lower your blood pressure in the mechanism that I described. And they basically looked at different types of blood pressure: systolic blood pressure, diastolic blood pressure, mean arterial pressure. And they found out that a drug called trandalapril was the best at lowering blood pressure, basically, and enalapril was also very good. A drug called captopril was kind of in the middle, and the worst was lisinopril. In fact, lisinopril was worse than doing nothing for lowering blood pressure. Okay, so next. Okay, so the best drugs, trandalapril and enalapril for lowering blood pressure, and placebo was way down the bottom, but lisinopril was the worst apart from in mean arterial pressure. Then they looked at deterioration of renal function, because one of the things that doctors are concerned about when you have high blood pressure is your kidneys. And so they'll often put you on a blood pressure lowering drug to protect your kidneys, especially if it's a bit high. And they found out that enalapril, one of the best drugs for lowering your blood pressure, if you want to split back, look, enalapril, one of the best drugs for lowering blood pressure, was actually worse than lisinopril for stopping renal deterioration. But once again, doing nothing was better than lisinopril, and the best drug for stopping kidney dysfunction and slowing it down was captopril. But basically, placebo was better than just about everything else for stopping your kidneys from deteriorating. Most other drugs for lowering blood pressure actually made kidneys worse quicker than doing nothing, even though they were better at lowering blood pressure, apart from captopril. Then they looked at death. Okay, and are these drugs actually decreasing the amount of death? And so lisinopril, the worst, enalapril, pretty bad. Captopril, even though it was better than placebo at stopping kidney deterioration, placebo was better than nearly all of the drugs, apart from ramipril, for actually making you live longer. So basically, the best drugs for lowering your blood pressure were actually worse than doing nothing for actually allowing you to live longer and keep your kidneys. So at the end of the day, ramipril and captopril, depending on what your problem is. So doing nothing is better than almost any drug at keeping you alive, even if those drugs lower your blood pressure. This means you must actually try and find the cause of your blood pressure, because blood pressure is a symptom. It's caused by something, and the drugs are just acting like a plaster. So if you're at home, stop, have a think, have a yawn, write a note, and then continue. Further news on drugs found that the harder hypertension is controlled, the higher your risk of stroke, even if the treatment is successful in lowering your blood pressure. They basically found out that the risk of stroke goes up 33% with each blood pressure medicine required to treat blood pressure as the goal. So it basically means that if you need 3 drugs to control your blood pressure, okay, you're 2.5 times more likely to have a stroke than someone who's got that blood pressure without any drugs at all. So the numbers, yeah, it's great, but your risk is still far higher because it's not treating the cause. Now, here's some big surprises. Did you know that half of all adults are actually already taking a drug that increases their blood pressure? Yes, increases their blood pressure. This is a big study, you can read this later, but basically, and half the people in this group, they were taking a drug that is actually known to raise blood pressure, and half of those people actually had high blood pressure. And basically, non-steroidal anti-inflammatory drugs, so things like aspirin, ibuprofen, steroids, birth control pills, antipsychotics. There's also antidepressants as well. There's a whole range of drugs that have actually been found to actually increase blood pressure. And so instead of finding out the cause, this is one reason, again, why chiropractic care, physiotherapy, osteopathy, massage therapy, if you have pain, arthritis, for instance, you need to find the cause of the pain. Treating it with a painkiller, actually, like steroids and anti-inflammatories, actually makes your health worse. You're going to be in more pain, you're going to have more health problems. You need to find the cause of your pain, get the cause of the pain treated, and then you don't need the drugs. Same with depression, etc. Find the cause, get off the drugs. Birth control, well, yeah, it's your choice, obviously. So anyway, pills don't build health. They actually can cause you to die younger. And one of the reasons that people stop taking drugs anyway, even if they are actually helping, is the side effects. And there's a very, very long list of side effects. And one of the reasons for all the side effects is nutrient depletion. Yes, every single pharmaceutical drug, because it drives your metabolism down one way, it actually causes deficiencies in multiple things. So let's have a little look at some of them. ACE inhibitors, for instance, lower zinc. So ACE inhibitors tend to end in pril a lot. So enalapril, lisinopril, ramipril, for instance, captopril, they lower zinc. Now, what does zinc do? Now, if you have low, zinc is needed for wound healing. It's needed for your immune system function properly and fight off infections and viruses. It's needed for your taste and smell, and it's needed for your sexual health as well. So, blood pressure drugs, ACE inhibitors, lower zinc, and so that can lead to slow wound healing, decreased immune system function, loss of taste and smell, and sexual dysfunction in some people. Beta blockers, lower coenzyme Q10 and melatonin. So beta blockers tend to end in ol. So bisoprolol, perindopril, metoprolol. There's lots of ols basically. Low enzyme Q10 can lead to decreased protection against cancer, aging, tiredness, cognitive heart failure, increased lipid levels, and low coenzyme Q10 is actually linked to high blood pressure. In one study of people with high blood pressure, they found out that when they were given 600 micrograms, I think it's micrograms, basically a huge dose of coenzyme Q10 for 6 months, 80% of people were able to come off their blood pressure medication. Okay, and yet one of the main blood pressure drugs actually causes you to go low in something that can cause you to have high blood pressure. Low melatonin is linked with insomnia, depression, growth hormone deficiency, blood sugar changes, decreased protection against cancer and aging. So yeah, beta blockers, not very good. Calcium channel blockers, they lower potassium. And yeah, calcium channel blockers, yeah, there's a few different versions, but basically potassium, okay, if it's low, can cause tiredness, edema, abnormal heartbeat, and high blood pressure, mental confusion, dizziness, and muscle weakness. So there we go. Diuretic drugs like furosemide can cause magnesium deficiency, potassium deficiency, sodium deficiency, which is no bad thing if your blood pressure is caused by too high sodium. It can cause zinc deficiency, B1 deficiency, B6 deficiency, vitamin C deficiency, and calcium deficiency. Now, a side note about vitamin B1, okay, is that there's actually an entire textbook about 500 pages thick on vitamin B1 and all of its deficiencies. And the authors are pretty strongly convinced that nearly all drug side effects are because of a vitamin B1 deficiency. And if you just address vitamin B1, a lot of your side effects are going to go away. But they also found that a lot of people, when they start taking vitamin B1, a lot of their health problems that they needed drugs for in the first place can go away as well. So I learned that from Dr. Brian Walsh, one of my mentors over at Metabolic Fitness Pro. Go and check him out, especially if you are a practitioner. So very, very, very powerful stuff. Another blood pressure danger, they found out that the older, frailer population, when taking ACE inhibitors, are 53% more likely to have a hip fracture within about 45 days, and 58% higher fracture if they start a beta blocker. So if you're already a little bit older, suddenly taking a blood pressure drug can actually make you more dizzy, more likely to fall over and break something. Overall, the state of play, the overall reliance on drugs has led cardiologist Dr. Asim Malhotra to say honest doctors can no longer practice honest medicine. We have a complete healthcare system failure and an epidemic of misinformed doctors and misinformed and harmed patients. That was back in 2018. It's now 2021. He's still preaching the same message along with more and more cardiologists, medical doctors, and alternative practitioners, because we realize that the healthcare system really is completely broken because it's reliant on drugs rather than fixing the cause. So, have another break. Have a think. Have you one? Are you learning? Are you a little bit surprised, or are you actually, I thought this already? So what are the causes of high blood pressure? Well, this isn't even an exhaustive list. This is just a big list. So causes of high blood pressure: obesity, poor diet, dehydration, excess alcohol intake, potassium and or magnesium deficiency, sodium excess, inflammation, essential fatty acid imbalance. That's primarily too much omega-6, not enough omega-3. Mitochondrial dysfunction. Your mitochondria are the things inside your cells that basically allow your cells to create energy and also to do things like create your natural anti-inflammatories, and also creates insulin as well, and testosterone and estrogen. Dyslipidemias, high homocysteine, low vitamin D3, chronic stress, insulin resistant, thyroid dysfunction, and dysbiosis. That's your bacteria that live in your gut. If you don't have the right bacteria in your gut, it can cause high blood pressure. Now, only one of these is treated, well, two of these can be treated by medications. Sodium excess and dyslipidemia, they can be treated by drugs, but as you said, they are just part of the problem. And in fact, all drugs actually make dysbiosis worse. Nearly all drugs make mitochondrial dysfunction worse, which can lead to then other problems like heart disease and cancers and brain fog and all kinds of other stuff. So as you can see, there's lots of causes of high blood pressure, some of which you may recognize. And that's the place to start, is finding out which one of these is causing your high blood pressure. And there's more, which I'm going to go through in a minute. Find out what's causing your high blood pressure, work on that, and the problem is solved. So let's talk about genetics though, because I know a lot of people really think that their health problem is genetic because their parents had it, their grandparents had it, and I've already shown you and already spoken and given you 2 examples where even though that was true, it wasn't, because the people did what was needed and their problems are solved. This is Professor Tim Spector. And he said the biggest twin study in the world, and a couple of my patients are in that study. 13,000 twins, some of them are identical. Now, the thing about identical twins is they have identical genetics. So that means there's no genetic difference between them. And yet they found that one twin could have all kinds of health problems, heart disease, high blood pressure, and the other one could be completely fine. And what they found out, that the health of the individual is more down to what they eat, and very specifically, the gut bacteria, the microbiome, what's actually living inside their gut, was more a predictor of their health and their disease state than their genetics. And they found out that eating and lifestyle trumps genetics. So, yeah, in particular, getting enough fiber is one of the biggest things. So get more fiber. And then another study on genetics, and this is actually on prostates, not prostate cancer, rather than blood pressure. But this is Dr. Dean Ornish, and he basically put people through a 90-day health and wellness and lifestyle program. And after 90 days, about 400 genes were changed. Some of the healthy genes got switched on, some of the unhealthy ones got switched off. And this through diet and lifestyle. 90 days, completely changed how people's DNA was being expressed. And then this is more recent, and this study is really exciting because the products that we used in this company are actually a sister company of one of the companies I use, and so I actually know exactly what was in this program and can put you on this program if you wish. They basically took a group of people and they put them through an 8-week treatment program, including diet, sleep, exercise, and relaxation guidance, as well as supplemental probiotics and phytonutrients, that stuff you find in plants. And basically, people became epigenetically, they became genetically younger in 3.2 years. So the things that basically are altered by your lifestyle, they were improved. They were made 3 years younger in just 8 weeks. Imagine if you did this for a year, how much better you would feel. So have a think, have a drink of green tea with ashwagandha and turmeric in, or ginger rather, actually. Okay. Stressed. Are you stressed? As I've already mentioned, stress is a big cause of high blood pressure, and drugs can't necessarily treat stress. So beta blockers can lower the effects of the nervous system effect of stress. If you actually deal with stress properly, then things are much better. Stress has been dubbed the Black Death of the 21st century. And one of the things I do with my patients is actually find out what kind of stress, how stress is affecting their system. And then I give them ways to basically make them more resilient to stress, because stress is going to happen. And in fact, if you work with stress in the right way, you can actually make stress your friend. And that's called hormesis. Hormesis basically means whatever doesn't kill you makes you stronger. And so when you actually work with your body in the right way, you can make yourself stronger. You can use stress. So think about that. Would you like to make stress your friend and something that makes you stronger? Yes, you would. Of course. Now, this is one of the biggest hidden causes of not just high blood pressure, but also, I mean, it's a bit more accepted that pollution and toxins are causing cancer and immune dysfunction. And yes, they lead you to have more viral problems as well. But also pollution and toxins are actually a major cause of diabetes and blood sugar problems. And that's the case of my father. Not overweight, not sedentary. It's actually toxins that are basically making his liver unable to control his whole system. So anyway, pollution and toxins, but let's get off of blood sugar and back to blood pressure. So certain toxins include heavy metals like lead, mercury, thallium, and lithium salts. All of these things are in our environment. And a lot of people actually inherit a lot of lead from their mother. It embeds them in their bones and their blood vessels and their soft tissues and makes them more predisposed to having problems later. And the sad news is that it's been found that there is no acceptable level when it comes to toxins, because they have found that, they being scientists, that even a very low level of a toxin that isn't actually related to killing you directly, because it's such a low level, it slips into your body and your body doesn't get rid of it because it doesn't really detect it. But a toxin is a toxin because it causes damage, and just because there's not very much of it doesn't mean to say that it's not going to cause damage. So you have one toxin in your body at a very low level causing a little bit of damage, and it may not be noticed for years and years and years, but slowly it's causing some damage in part of your system, whether it's blood vessels or your brain or your heart or your immune system. And then you add a second drug at a minuscule the second toxin at a minuscule level that you've maybe breathed in, or you've drunk in some water, or it's in your food, and then a third, and then a fourth. And in fact, every year and every month there seems to be another study showing how many more toxins there are than there were a few years ago. There are now over 100,000 man-made toxins in our environment that our body has no idea what to do with and how to cope with it and how to detoxify properly. It's under stress and strain. And every man, woman, and child tested has been found to have at least 700 different man-made toxins in them. And it gets even worse than that. Even though they can accumulate and start causing problems by themselves, it's found out that when certain ones combine, they actually become hundreds of times more toxic when they're combined together. And when they combine with a third or a fourth and a fifth, it's just causing havoc. And it's basically got to the point now where it's not a question of finding out, are you toxic? The answer is yes, unless you're doing something to get rid of toxins from your body and to minimize the amount going in, you are toxic, and you need to do something about it, because it could be causing you cancer later, it could be causing you dementia later, it could be causing your high blood pressure right now, and it could be causing your high blood sugar and your diabetes that's uncontrollable by diet right now. And there's no escape from pollution. Okay, even well, Eskimos, which isn't the right word, none of the people native to Nunavut, which is northern Canada, Inuit adults, basically, they found out that they're breathing in, or it's getting in through the fish they're eating, persistent organic pollutant levels in their serum is causing them to have high blood pressure. So people even miles away from factories, hundreds of thousands of miles away from so-called pollution, are suffering from pollution, and it's causing them to have high blood pressure. Has your doctor suspected this? Has your doctor thought that maybe your diabetes and your blood sugar problems and your blood pressure problems are to do with toxins, and are they doing something to get rid of them? Or are they just saying, no, it's not? Okay. Even whales are suffering from air pollution. Yes, whales in the ocean have been found to actually be suffering from air pollution, basically. And this is one of the reasons why I recommend that people buy air filters, especially for their bedroom where they're breathing all night long, especially if you live inside the M25 or in a city, get an air filter. But basically, if even whales are suffering from air pollution, then no matter whereabouts you are in the country, you are suffering from air pollution. And not only can you do something like have an air filter or an ionizer in your bedroom, in your office, I've got one down here, I've got another one up there. You can also, there are certain nutrients that have been shown to actually remove some of these particles and pollutants from your body. And in fact, there's a whole process I use to actually help clean the entire body of all kinds of toxic gunk and rubbish, so that you can go from a goldfish with high blood pressure living in a dirty bowl to a happy, healthy goldfish in a clean, lovely bowl. And here's the story. It's about a wedding cake. No, it's not about a wedding cake. This is just one of the cakes that one of my patients, Derek, made, because he is a cake designer. And he was concerned about his blood pressure. It's 132/84. Now, a lot of people wouldn't be concerned about it. And certainly when I graduated originally, we wouldn't have been concerned about 132/84. But his father, I think, died young. His family were worried about it. His doctor kept on going on about it, and he was pretty healthy and fit though, not overweight, active. He did have one weakness, but anyway, 7 days of detox, and he could run faster, which isn't down here. I don't think I'll put that down. He beat his personal best, or he could run faster. But basically, his blood pressure went down to 115/78 in just 17 days, going through a 7-day detox protocol. Here is another cause, though, that because I mentioned heavy metals, and heavy metals were something that a lot of functional medical doctors were really hot about for many, many years. But actually, the world is actually doing a good job at clearing up a lot of heavy metals. But unfortunately, mold is on the rise. If you have got any mold in your house, or if you've lived in a house with mold in, or if there's mildew smells in your house, then there's a chance that some of this mold could be getting inside you. And it's now being recognized that mold can be a cause of many chronic diseases, brain fog, cancers, gut problems, and yes, high blood pressure as well. And there are some tests that you can do to actually check to see if you've got mold in your system, and there are ways to get rid of the mold. So have another think. Have a yawn. So what are all these things doing that causes high blood pressure? Well, it's about what's called your epithelium, or the specific part of it called your endothelium. And your endothelium, okay, this is a picture of some blood vessels, is the basically thing that makes your blood vessels walls. It's the thing that lines all your hollow organs. So it lines your gut, it lines your heart, lines all your blood vessels. And there's lots of it. And if it gets damaged, it causes problems. In fact, if it gets damaged and you can't repair it, your body will take some cholesterol and stick it on the side of the wall, a bit like some plaster. But again, if you don't have the right nutrients, or if the damage you're doing is outstripping the nutrients you have, then you can't repair it properly. So you stick more cholesterol onto the artery wall. And this is why, again, just going after cholesterol can be a red herring, because cholesterol can be plaquing to the wall because it's trying to save your life. But it then causes other problems because it can clog up the arteries around your heart and blood vessels, and then you have a heart attack. But if you actually start doing the right things to repair your endothelium, then the plaques disappear naturally, calmly, peacefully by themselves. So healthy epithelial cells and endothelial cells are stuck together to stop things getting where they shouldn't be. It's like a lining, basically. And it's very important for your entire system. I won't go into all the details. I'll just stick with capillaries. So capillaries, there's the endothelial cells around the outside. There's 4 in this capillary. There's a red blood cell in the middle. And then on the inside of the endothelial cells, there's a gel-like structure known as exclusion zone water or structured water. And this structured water has a positive charge, and your red blood cells should have a negative charge. And part of the process of basically getting red blood cells along your capillaries is actually caused by this charge, this flow. In fact, experiments have shown that when you get a straw that's positively charged and you put it in some water with some negatively charged particles, you actually get a flow of water through this straw. And so the theory is this is one of the things that keeps our blood pressure lower, because it's not the heart that's doing all the work. It's actually our red blood cells are being pushed along electromagnetically, like a magnetic train, basically. And there's cholesterol sulfate is very important for this. Yes, cholesterol sulfate is very important for lowering your blood pressure. So just lowering cholesterol throughout your entire body can be a big mistake. But when this layer gets destroyed because your endothelial cells aren't working, maybe because you haven't got enough nutrients to make healthy endothelial cells, maybe various toxins and pollutants are damaging your endothelial cells, then this charge breaks down and your heart has to work harder and your blood pressure goes up. That's a basic way of looking at it. Okay, so now you know. Have a think. Now, one of the other things that causes damage, or kind of the missing link, the thing that brings it all together, is your immune system. Your immune system plays a prominent role in the initiation and maintenance of hypertension. It's been known for a long time that when you've got high blood pressure, there's something going wrong with the immune system as well. And this is why at the beginning of the coronavirus epidemic, or endemic, I should say, is the correct word. It's not an epidemic, it's an endemic. It was found that people with high blood pressure were suffering so badly and dying because people with high blood pressure literally have an inflamed, overactive part of their immune system, and COVID makes it worse. And so, yeah, researchers at the University of Edinburgh found out that there's part of your immune system called your macrophages, and they eat a chemical that's known as endothelin. Now, what endothelin is, it must have some use in the body, otherwise it wouldn't make it. But endothelin is really bad for your endothelium. It actually damages your blood vessels. And so the job of your macrophages is to go around and eat this endothelin. But when you aren't nourished well enough, when you have a stressed immune system, your macrophages don't work properly, or you make more endothelin, one of the two. And when the University of Edinburgh found out that when diet and lifestyle was improved, they basically found that the macrophages worked better, or endothelin levels were lower, and blood pressure went down. And they've also found out, for instance, that endothelin is actually, I don't think I've got the slide in here anymore, no I don't, but endothelin 1, so stress, nutrient deficiencies, toxicities, pollution, air pollution has actually been shown to basically increase endothelin 1 in children. So yes, air pollution is causing high blood pressure in children. So if you live within London and you have a child, okay, get an air filter for their bedroom and put them on the right nutrients to lower those chemicals in their body as well. contact me. Protect your children. This is James Scrimshaw. He's not a child. He's a doctor of chiropractic, and he came to me because he was basically unhealthy. He had eczema, reflux, used an inhaler, and basically we put him through what I call the Magnificent Seven training program, and that's Magnificent Seven health strategies, which I'll talk about later. He lost 19 pounds in 2 months, effortlessly, he said. And now he basically, his eczema cleared up, reflux went away, and his breathing got better. And eczema, reflux, it's all to do with an inflamed, overactive immune system. And so when we did the right things, his system worked better. He became much, much healthier and in love with what he did again. So have a think about that. What is possible for you when you clean up your act in the right way once you find out what's wrong? And here is one more cardiologist. And when I was growing up, Dr. Christian Barnard was massively famous because he pioneered heart surgery. And that is an amazing thing, and it saves thousands and thousands of lives. He himself, I think, did 150 heart transplantations, but he said, I've saved the lives of 150 people from heart transplantations. If I had focused on preventative medicine earlier, I would have saved 150 million. After pioneering heart surgery, he basically tried to make people realize how important nutrition was, and he came up with his own supplement routine and regime as well, and lots of other ways to basically help lower heart disease and lower blood pressure. Very, very important, but again, never got taken up seriously. So now I hope you see that there is a better way than medication for lowering your blood pressure, a more permanent way of lowering your blood pressure, and a more satisfying way of lowering your blood pressure. So what makes us different and what's next? Well, traditional medicine, as you perhaps already know, looks at crisis. It waits for there to be a big problem. Whereas what we do in the aligned health model is we help prevent problems. The traditional model looks at populations. We look at you as an individual, and we listen to you. We give service, we coach you, we try and enhance your system. We empower you as opposed to making you a victim. We like to try and have you as a health participant rather than a patient. We, instead of ignoring things, we try and predict things and listen to you. Instead of being very general, it's very personalized. It's not mechanistic, it's very holistic. Instead of treating blood pressure as a symptom, we realize that, or rather than treating the symptom of high blood pressure, we realize that there's a root cause of your high blood pressure or whatever you're coming with. And we want you to participate in your own health and learn, not just for yourself, but also you can take what you learn and apply it to others, because it will be directly applicable to helping other people. Even though it's personalized to you, there's a lot of general themes that help everybody, which are the Magnificent Seven health strategies, which are think right, talk right, drink right, eat right, move right, detox right, and sleep right. When you get these 7 elements right, and there's actually an 8, but I start with 7, it protects your body, your brains, and your bowels, and so you are healthy. And also, when you think right, talk right, drink right, eat right, move right, detox right, and sleep right, it protects you from toxins, stress, and trauma. You bounce back more easily. And when you implement correctly by focusing on the Magnificent Seven process, you can expect to reduce body fat, tone up, and get leaner. You can have more energy and feel better about yourself. You will develop a bulletproof mindset. You'll have freedom with your nutrition, break free from calorie counting and worrying what to eat and not eat. You will become fitter and stronger, reduce the risks of high blood pressure, heart disease, diabetes, and many other preventable illnesses. And yes, there is a specific Magnificent Seven for blood pressure, and that's looking at hormesis to beat stress. Nitric oxide is the talk right miracle molecules. When I'm talking about talk right, I'm not talking about you talking to other people and communicate. I'm talking about internal communication, and nitric oxide is a miracle molecule. It's also destroyed by air pollution. Just thought I'd throw that in there. Easy water, so structured water, because hydration is more than just drinking water. The right kind of food, the paleo dash diet, I call it. Goldilocks exercise program, because too much exercise can be just as bad as not enough. The blood pressure blitz detox system, circadian rhythm. This rhythms that you set up in the day to help you sleep and wake and have energy. So, would you like the Magnificent Seven applied to you? Yes, you would. So here's one of them, nitric oxide. Nitric oxide declines with age, and nitric oxide is something that is actually made, it's made in many different places in the body, okay, but it's made in all your cells. And in your arteries, it's actually released when you do a little bit of exercise, okay, a little bit of vigorous exercise. It's released and it allows your arteries to dilate so that they can relax and deliver more nutrients and oxygen. But also, nitric oxide is actually used in part of your immune system. It's used in the brain as a signaling molecule as well. It's very, very important. And certain things use it up, and certain things make nitric oxide go out of control. And there's actually an inflammatory kind as well. And so one of the things you want to do is you want to make sure you have enough of the right things to make sure you can make the nitric oxide you need when it's needed. And one of the best ways to get it is get more beets in your body. And so this is a recipe I got from Dr. Al Sears in America. And you take 1 organic beetroot, 2 raw organic carrots, half an organic cucumber, 3 stalks of organic celery, 1 fresh lemon, and some water, and you blend it all together basically, and then drink it. And you can do it, in bits throughout the day, but this is going to get lots of nutrients in your system that you need for making nitric oxide. Plus, you'll get lots of good nutrients, full stop, in your system. So give that a whirl. Another way to boost nitric oxide is actually by doing a little bit of very simple workout with your forearms. If you'd like to know this forearm workout, then email me, because I will send you stuff to do with your forearms. I'll send you another nitric oxide. I'll send you a nitric oxide workout. I'll send you a whole list of different foods. I'll send you the nitric oxide diet. And there's also humming improves nitric oxide as well in your sinuses and your airways. So email me and ask. So nitric oxide, that's one of the Magnificent 7 for your blood pressure. You can have that one for free. However, you may have already tried nitric oxide because there's a lot of information out there about it. So the next thing to do, if you want to actually take a shortcut, you want to actually find out what's really wrong with you and what to do and start making a big change, is you need the 21st century blood pressure consultation, which is different from what happens at a medical doctor's. And this is not about trying you to stop taking medication. This is just to find out what's causing it, to apply a program. So you, when you go to your doctor, you can say, look, my blood pressure is completely fine now. Can I come off the medication? And the doctor goes, yes, it's completely fine. You can come off now. There we go. So what is this? Well, basically, it's a comprehensive cell system and energy evaluation to uncover the blind spots and underlying causes of your issues. Okay, I'll send you some more information on that. You can actually basically just go to this website. I will email that out afterwards so that you can actually just go and click on the link and check it out. You'll spend 55 minutes with me to help you read between the biological lines to create a customized plan of action for your health goals. We'll identify the #1 action you need to take to get off your blood pressure medication by getting it down, okay, how to implement it, and supporting practices so you can use it to accelerate your results. We're going to help you apply the blood pressure brakes. You're going to have access to the most cutting-edge cause-based functional lab tests for you to see if there's anything really hidden that hasn't been tested for that can help resolve specific red flags that are blocking your performance. So if you'd like to take me up and do that, then you just click on the link. Okay. One of the things we're going to go through, we're going to send you a very comprehensive form, because not only do you get 55 minutes with me when you have the consultation, we're going to send you some forms and information. We're going to request information from you first of all. And even before I speak to you, I'm going to be spending about an hour going through everything that you send me in detail and collating it. It won't take you an hour to do everything. It should take you less. But I'm going to spend an hour looking at everything, and I'm going to help basically determine whether you've got nutritional deficiencies, whether various organs like your adrenal glands are stressed out, your thyroid, whether you're toxic, by looking at your symptoms as well, because there are specific things we can ask you that help determine what's going on with your system. One of the reasons that doctors don't get into this is because they don't ask enough questions, because they don't have the time and they don't know what the questions are. And we're going to send you something called the Cell Blueprint questionnaire that's going to really help us home in on whether it's toxins, whether it's nutritional deficiencies, whether it's dehydration, whether it's another system failing, and we're going to help find out what needs to be worked on. But also, so we're going to give you, this is what your results will look like. You're going to reading, but also, this is really, really good, okay, to know about, is that normal is not healthy. I would hazard a guess that you had blood tests from your doctor and they pretty much said that it's all normal. Maybe you've got some high cholesterol and that's it. So this is a normal result. This is a normal blood test results from a real patient who is anonymous. And what happens most of the time is, let's just look here. Serum cholesterol is 4.7. Serum HDL cholesterol 2.1. So you can see there's nothing written down here that there's a problem at all. AST, this is a liver enzyme, it's 14, look, it's healthy. Serum LDH, look, 283, it's healthy. It's all within, look, it's all healthy, it's all fine, okay? But unfortunately, all these healthy ranges over here were based really on an unhealthy population to begin with. And what we now know that, for instance, the truly healthy level of ALT is actually different from just being under 41. And in fact, there's actually some things that can actually, there's some things that are bad for us that can actually lower these numbers, and there's some things that can raise these numbers. So you can actually have two things that are bad for you, one that's lowering the numbers, one that's raising the numbers, and yet the numbers can look completely normal and healthy. But if you do the right kind of history, ask the right questions, you can suspect what's going on. And then what's going on all of the different blood test numbers, you can actually figure out what's really going on. So what are the really healthy numbers? Well, it turns out that this HDL number, it's not good. This LDH level, that's not healthy. This bilirubin level, that's not healthy. Mean corpuscular volume, that's not healthy. Red cell, blood cell distribution width, that's not healthy. Platelet count, that's not healthy. Neutrophil count, that's really not healthy. Monocyte count, that's not healthy. And they all mean stuff when they're not in the actually optimal healthy ranges. And it can help us determine what's really going on. So when you go to a medical doctor, you'll get this, which looks pretty much meaningless. And even to a doctor, it turns out it may actually be quite meaningless. And one of the things I can do is I can give you a report that looks like this, but I've stopped doing that because that also, unless you want it, it's interesting, but it's meaningless. Whereas this is actually what all those different blood test results being high or low means. It can help determine what are the things that are likely going wrong, where we need to actually work. And when you combine blood test results with cell blueprint results, other questionnaire results, your history, then we can determine the next step, what to do. So if you would like a consultation, normal price is £397. But if you've watched this webinar, I already know that I've answered a lot of questions. It's going to save me a lot of time. So you can save £200. And if you go to this link, you'll see that it's £197. And yeah, someone who went through the program. This is another doctor in Ireland, Dr. Simon Kushal, and she said goodbye to 15 kilograms in less than 2 months. And also, now this is actually a test that I get people to do, is can you get down onto the floor and up again without using your hands? Okay, because that is actually far more of a predictor of whether or not you're going to be alive in 10 years than, say, for instance, just high blood pressure or just high cholesterol. And so this young doctor, we managed to get her to lose 15 kilos, and also she was able to get off of the floor and run around after her young child, which was very important. And the consultation is protected by my no hassle 100% money back guarantee. So that means you can book, you can pay the money, we can send you the information, you can send it back to me, we can do the consultation. And if you feel that it's not worth your money, then you can have your money back, no questions asked. So the blood pressure consultation allows us to actually discover what's really going on. So we discover like our biotoxins or environmental toxins, the likely causes are micronutrient deficiencies, the likely cause. Is it your nervous system and stress? Is it gastrointestinal abnormalities? We can help find out what's really going on. And if we suspect something but we're not quite sure, we can order further tests as well. And then once you've discovered that, basically we can customize a program for you. And when we customize a program and you follow it, it will lead to a brighter, newer future. If you do nothing, you'll probably get worse. Even if you follow the traditional means, it looks, this diagram says, oh, you're going to be the same, but probably you'll be worse. Because if you don't take action, your clean arteries that are clean, will probably just get dirtier and rusty. Your epithelial, your endothelium will just be more dysfunctional. So what comes next after the discovery is the recovery. Okay, and so that's where we actually can customize a really in-depth plan and you follow it as well. And so we want to create purity, we want to optimize nutrients, we want to maximize psychology as well. What comes next after the recovery is thrive. This is where we actually show you what you can do once you've actually completed and got to where you want to do to actually even get better or sustain it for the rest of your life or as much as possible. So discover where you are and what is your healing potential. Recover, we address the hidden root causes of disease. Okay, and thrive, we create long-term sustainable results by focusing not on the root cause of disease, but we actually get you to focus on the root causes of health. So you can grow more health and become an explorer. How does that sound? A longer, healthier life is the result. So that is the end of the big information for the moment. So what'll be really good right now, okay, because there's a bit more, okay, to do, is stop the replay, okay, and then I want you to yawn 3 times. I want you to yawn, relax, enjoy the peace and silence, because if you've done some yawning now, you realize that after you yawn, there's kind of a peaceful thing for a while. You don't want to do anything. This is why yawning helps you relax and fall asleep, because it creates peace in your brain. So have a yawn, relax. Have a yawn, relax. Have a yawn, relax. And then take your blood pressure again. So stop the replay, do 3 yawns, take your blood pressure again, and then email me your blood pressure before you carry on with the rest. As I'd like to know whether it's higher, lower, or the same. Hopefully it's lower. So once again, okay, the blood pressure consultation, if you've now done the triple yawn, you've seen that, oh wow, just this one thing has helped, and you can see so much sense, you want more, and you want to do something to make some permanent changes. Click the link, and then once you've clicked, you'll come to a page where the top of it looks like this: the cell systems process that enhances energy, balances blood sugar, and lowers blood pressure. You click on the reserve your spot now button. It's taken to this page here. You fill in your details, your credit card number. You click on the complete order. Remember, it's 100% money back guarantee. It says on here 45 minutes, but it is 55 minutes that you'll get with me. Click on complete order, and it's 100% money back guarantee. Okay, and then you'll get to a page like this, and you want to click on the beat blood pressure booking, and you want to click on the one that says body and balance with the logo. I think there's still 2 that's showing, but basically if you click on the and then you also want to select me. So if you click on next and it doesn't go anywhere, you just have to click on my face first of all, then click next. Okay, and then it should take you to this page. If it doesn't take you to a page where you've got dates to choose from with dots on, and then when you click on a date, it's got dots on, and then it will show you the times that are available. If it doesn't take you to this page, go back and click on the other button, okay? Because you clicked on the wrong button. Then you fill in your name, so you choose the time, you select the time by clicking on it, you fill in your name, your email address, your mobile phone number, date of birth. There's no online booking code, you just press next. And it should all be done, okay? Now, one thing I would ask you to do though is I don't get an automatic notification. It will show up in my diary, but occasionally it doesn't show in the diary. So once you've booked, please email me and tell me the time you've booked, because then I can actually send you the forms to start filling in, and I'll send you what else we need from you to help get you to where you want to be. So hopefully now you will know that natural approaches, they work, they have less side effects, and they improve multiple areas of your health and well-being, not just blood pressure, but blood sugar, brain power, all sorts. So if you agree that you do have high blood pressure and therefore hidden health issues, you want optimal health blood pressure, and you want a longer health span, and you want to live without drugs, then it's up to you to sign up and take the next step. So remember, we will discover what's really going on. We'll get your immediate quick win to turn on the blood pressure brakes, up-to-date lab test analysis, your chance to go through the 8-week anti-aging program if you want to as well. So if there are any questions, now is the time to ask, and feel free to email me as well if you're watching this on the replay. I know there are no questions now. And so thank you very much. And if you have any problems with email, then just try phoning on 01 707 662 704. So thank you very much for watching. You are awesome. You deserve magnificent health. Reach out. I am here to help. And I will just say hi, so you can see me fully. I'm here to help. Just reach out, email, phone, and we'll help you in the best way we can and give you the best advice in the time that we have. Thank you very much for watching. Be well.